speaker for this session this morning is Hannah Timpson, who I'm sure you've all met already this morning. So Hannah isn't a colleague of mine, so not much more I could say, so I'll hand straight over to Hannah and let her introduce herself.
Thank you. Thanks, Julie. I'm going to talk about a piece of research that I have done in collaboration with Food Active, which is a healthy campaign collaborative that was set up at the request of the Departments of Public Health across the northwest of England. And the remit to the project is really in line with exploring options to tackle obesity. Genevieve and Ian have already sort of explained interventions that aim to try to tackle behaviour, change behaviour to help to tackle the rising obesity levels. And one of the methods to try to do this that has been more recently explored is putting a tax on sugar. And I'm sure that you will be aware that there has been quite a number of different articles and debates in the media around this issue and taxation of sugar. And what we were doing was looking specifically at a tax on sugary drinks. So there's been a number of different modelling studies that have been done over the past, particularly over the past couple of years, that have been published in journals such as the BMJ, and there have been a number of different interviews on media across the UK, really sort of outlining the results of these modelling studies that have had varying different results in terms of the impact and implications for obesity. But all of them have suggested that placing a tax on sugary drinks would lead to a reduction in obesity, and then that would have implications for the costs on the NHS and the wider health and social care economy. I mentioned that there are various different predictors of the impact and the level of that, and there's a number of different parameters that are placed within these models. And if you are interested in any more of that information, then I can talk to you about that afterwards and give you some references and key reading. But what we wanted to do, because there's quite a lot of work that's been done to model the impact of a tax on sugary drinks, we wanted to actually speak to people and find out what did they think of a tax on sugary drinks, and did they think that they would change their behaviour. And we looked at 20% tax on sugary drinks as kind of our key for this, because the modelling work that has been done has predicted that a 20% tax would have an impact on reduction of obesity. So in terms of the methods for the work, it was carried out across the northwest of England, and we wanted to specifically speak to those people who would most likely be affected by a tax on sugary drinks. So we wanted to find out attitudes, behaviours and perceptions, and we did this using a qualitative approach. So the research focused around family interviews, paired interviews, focus groups and one-to-one interviews. And we conducted the research with children, with young adults and with young parents, trying to really focus in on those people, because there are quite a lot of data that show that those specific population groups are more likely to consume sugary drinks. We also supplemented the qualitative in-depth interviews that we did with some surveys, which gathered exactly the same information but captured in a very much more quick way. So I've mentioned about the sampling and how we wanted to really speak to the people who we knew would drink sugary drinks. So the study design very much reflected the key determinants of this, and before we did the research, we did a literature review, and the report for that is separate and it's on our website if you're interested in that. And that really sort of provided us with the rationale of who we needed to speak to, who the highest consumers of sugary drinks were. So we went to areas in the northwest where sugary drink consumption was likely to be higher. So those areas with high deprivation and high levels of obesity. and we collected information from those people who we knew were most likely to consume or be affected by a tax on sugary drinks. And I've mentioned we spoke to children, adolescents, young adults and families. Just to very briefly give you a bit of an indication of the number of people that we spoke to, we gathered insight from 293 people in total across the North West. We conducted in-depth interviews with 125 of these, and then we gathered survey data from 168. And there's various different discussions that I can have about the methodology and how we did it, and various different ways in which we were supported with the data collection. And again, I can give you more information about that afterwards if you're interested. But what I want to do is kind of to go on and speak more about the findings and what we actually found. So what we really wanted to do is to find out, do people think that placing a tax on sugary drinks is acceptable? What we did was we used the 20% marker as that indication. So we gave the example at the beginning of interviews that a £1.15 bottle of Coke would now cost £1.38, and used that as a bit of an example. And we generally found that people thought that tax on sugary drinks would be something that would be acceptable, but that a 20% increase would not be enough to impact on consumption. And I've just got some quotes to illustrate these points. So there was one parent of a 9-month-old who said, "It's perfectly acceptable. I think it will work for a small minority of people, but it won't cure the problem." Somebody who we spoke to who was a residential manager for a children's home said that it was acceptable, but they weren't sure what the impact would be. And a focus group that we did with adolescents, they said they didn't really have an opinion, they didn't really think that they would notice an increase if it wasn't ridiculous amounts of money, and one person noted that there's lots of different prices for sugary drinks anyway. And that was probably one of the main focuses of all the discussions that we have, with people saying they can get them in home and bargains for a lot cheaper than they can get in other places. In terms of the reasons behind it, many of the adults that we spoke to were quite sceptical and felt that it was another way for the government to increase revenue. They felt that they would never be able to find out what happened to the monies that were raised. Many people of all ages felt that any revenue generated from a tax should be spent on education and on reducing the price of healthier items. And this supports some work that has been done by Mitten and by Fletcher, and also by Briggs in a paper that's just been published, which supports the notion of a tax in unison with subsidies on healthier items. One of the key things really around the education and the health side of it was that many people that we spoke to all knew the impact of sugary drinks on dental health, but there was very few people who recognised the impact of sugary drinks on obesity. So that was a real kind of key finding for us. When we talked to them about it and the reasons why we were doing it, we had lots of discussions with people saying, but what is good? What should it be? A lot of people assumed that sugary drinks were all fizzy drinks. So there was lots and lots of discussions that we had around that. There was a young mum who said that the money should be spent on educating young people, poorer families. One person, parent of the 9-month-old, talked about education and the need for families to be better educated, and she mentioned some of her experiences and the fact that she'd never been told about fizzy drinks. One person who had been attending a lifestyle weight management session, he had said that they should put worthwhile projects into the community. And this is my favourite comment, this is my favourite quote from the whole of the study. This was a little boy who was 8, and he said, "You should make the bad stuff dearer and the good stuff cheaper," which I think is a great quote. So I've mentioned that although lots of people felt that a 20% tax would be acceptable, they really didn't think that 20% would be enough to make a difference. So there was a young mother who we spoke to that said, "It's such a small increase in price, what difference would 20p or 23p make? If people want to buy it, then they still will do." An adolescent focus group said that such a small increase would not affect it. If it was a large increase, it would. If it went up from £1 to £2, they wouldn't bother then. And somebody who was the home manager and looked after children's homes said that from a young person's perspective, 18p wouldn't make a difference. some of the participants did suggest that people might change their behaviour if they couldn't afford to buy sugary drinks, and that they might buy a cheaper alternative instead, but they always talked about somebody else. They never talked about that in being themselves, even though they all drank a lot of sugary drinks. And again, there was some people who said, oh, well, lower income families, people with less money, they might be influenced to change their consumption if they didn't have it within their budget. And this young mum from Halton described how families who have a strict budget for their weekly shop might have to change their behaviour. And this might impact on the availability of sugary drinks to young people in the home, but it wouldn't really impact on sugary drinks consumption outside of the home if a young person could afford it. And this was something else that we found a lot in all of the discussions with young people who we spoke to. They just said if they wanted a sugary drink or a fizzy drink or energy drinks, which were the most frequently consumed amongst all of the groups that we spoke to, they said if they had the money in their pocket and they wanted to get a drink, they would just spend it. They wouldn't look at the price and think, oh, that's a bit steep. They would just spend it. And one person said that he'd been to a festival and he would spend £4 on a Coke, and so there was a lot of examples of that. So the finding around the family suggests that people in families being affected by tax and then reducing the sugary drinks that they have in their home might impact how much sugary drinks is consumed in the home. But if young people are carrying money about and then just spending that money, then only if the parents give them less money might that then have an impact. I just want to quickly run through some of the key themes that came through in terms of influencing the decisions that people described to us that they would make. This issue of passive overconsumption was one that was heavily featured in all of the data that we analysed. So this is really where people aren't recognising the calories that are in sugary drinks, and they're not compensating for that by changing their behaviour in any other way. So people not recognising all of the drinks that are classified as sugary drinks, people not understanding the implications of drinking sugary drinks on weight gain, people not understanding that and energy balance, and also not considering the risk for their health in the future. In terms of awareness and understanding, a lot of people that we spoke to who drank sugary drinks would almost be quite defensive about their behaviour, even though we went in with absolutely no premise as to what our position was. We just wanted to find out from them what they thought. So a lot of people who drank sugary drinks, there was quite a lot of people who talked about diet drinks. There's a lot of quotes in the report about people saying, well, diet drinks are really bad, they're even worse because they've got stuff in them like aspartame, and then they'd have a discussion about themselves because they didn't know what it was, but they'd heard that it was bad. And then this issue of availability, advertising, meal deals, parents, children, adolescents talked about how they're everywhere and that you can't escape them, and that if you want to buy a sandwich and a packet of crisps, that you have to buy a sugary drink because it's cheaper to buy all three. So there's this sort of complexity of influences which is impacting on people's behaviour choices. And just in terms of how we actually move forward, the study findings support research which highlights the ease at which people make unhealthy behaviour choices, which includes the consumption of sugary drinks. Heavy advertising, availability of unhealthy items in retail outlets has been a huge issue in terms of looking at the impact of the obesogenic environment, so the way in which the environment promotes obesity. And it really sort of links with this issue of passive overconsumption, people not knowing, not linking sugary drinks with obesity and not making any compensation for consuming those extra calories. So I have rattled through all of that, and there's a lot more findings that came out of the insight work that we did, and there was a lot more themes that came out of it. The reports are on our website, so obviously if you are interested then you can go and look into that in more detail. But yeah, does anyone have any questions?